We have confirmed 2 malaria cases in Crique Sarco Village. These persons had traveled over to Guatemala within the time frame and started with symptoms in the mid-January, and they were recently diagnosed. So these cases are defined as imported cases, which means that they had become infected outside of Belize. Even though it's imported, that we define them as imported cases, it's also important to note that we need to ensure that there's no transmission, no local transmission in country. So we still give the education aspects. We try to ensure that persons utilize what is needed, the repellent, the keeping the home screen, staying indoors, etc. And we also do enhanced surveillance. So we go to the villages and the surrounding villages. We test everyone. We look for persons with fever. We look for persons with joint pains and other signs and symptoms of malaria, and we do our testing. In Belize, with the Ministry of Health and Wellness, we're able to readily test for dengue, malaria, CHIKV, Zika, and so these are vector-borne illnesses that may present with very similar symptoms. So we are encouraging the public that if you do have any of these symptoms, just come to any of our facilities and you can be easily tested.
Did they go to a health facility?
Yes, they were. We do have our community health workers on the ground. We have about 300 community health workers, and these persons are our eyes and ears in our community. So especially in rural areas, they go house to house, they do health education, and they try to pick up anyone who's sick, or they do preventative messages as well, they do screening. So that is how these persons were picked up, through the community health workers who did the test and found that the test was positive, and then they were then taken to the health facility.